Addressing mental health and substance use continues to be among the top needs in the community. Suicide is a particular focus that data shows is creeping into the thoughts of younger and younger people, even before the age of 10.
That hits home here in north central Wisconsin. 7 Investigates' Emily Davies has been talking to dozens of people in our communities over the last month who are desperate to support students.
Yeah, 22. That's how many people in Marathon County alone who we have lost last year to suicide. 3 of them were teenagers. They were friends, family members, students, people with futures that were cut short. The negative statistics around mental health are overall getting worse. There is some hope, though. Here are just some of the people doing something about it. Wednesday, students at DC Everest Senior High had an adjusted schedule, giving them a chance to play,
Yeah, teamwork makes the dream work.
to enjoy some sunshine and the company of their friends and school supports.
There we go, just to show that Sully was here. Yeah.
It's part of their You Matter effort.
All of our schools, elementary through high school, have done a number of You Matter moments throughout the school year to say just that to our kids, that you matter and we're here to connect with you.
Reminders are placed throughout the school that each student is an important piece of the Everest community.
I got involved after losing 2 friends last year.
Students like Jaylee Thomas have taken the lead.
I thought it was just very important to advocate for people's mental health, especially because people think it's like not normalized to talk about things that they go through in their mental health when it should be.
She and other students around north central Wisconsin speak very matter of fact about the subject because it is matter of fact, especially when they've seen the darkest realities, the loss of friends, when not being okay doesn't feel okay to talk about, despite going through a pandemic.
I was teaching Kepler's laws, and it was doing something very easy at the board. What's 1 times 1? 1. But no answer. They wouldn't say anything. What's 2 times 2? Blank stares with masks on their face, so I can't even tell like their emotions. And before I went on and kept teaching, I just stopped. Are you guys okay? Is everything going all right? And I said, and then one of them said, no, we're not okay. This is really hard. I said, good, for sharing, thank you. And I'm sorry that this is hard. This is unlike anything any of us have ever had to go through.
That's reflected in the Youth Risk Behavior Survey data, where students anonymously answer questions about their behavior.
About half of our high school students are experiencing serious problems with anxiety, and just under a third are telling us that they feel depressed.
Hannah Schomer with the Marathon County Health Department says after analyzing the data further, they found those 2 admissions to be key indicators to watch for when it comes to a student's risk of suicide.
Those students who are experiencing serious problems with anxiety are 10 times more likely to consider suicide, and those who are feeling depressed are 15 times more likely to consider suicide.
Take a class of around 20 middle or high school students. About 3 of them have considered suicide. 1 of them attempted it. While these are Marathon County statistics, the data is about the same across north central Wisconsin.
You can't do well in school if your mental health is not doing well.
Mental health is not a school district issue, it is a community issue. We have the collective audience of the students being in school, so we have the opportunity to provide support. So we're just one piece of the puzzle.
Mental health, behavioral health, substance use, misuse has been a top 1 or 2 priority for every county across our service area for many, many years. The challenge is how do you deal with that, and how do you address some of those issues around behavioral health, because it is so broad and complicated.
We are working in our own pockets. You know, the school is working like, here's what we have to do, and then they don't know that there's outside organization, and then maybe a kid has gone to their primary care physician, and maybe the county has some interaction, or the police department, and we're all kind of working to all serve the same needs.
Issues of youth mental health cannot be resolved or solved by one entity, one person, one organization. It really will take a strong community effort.
In January last year, schools and organizations, largely in Marathon County, came to that conclusion.
It's really our role to play a part in finding a solution as a community. With some of the recent tragic events that happened in the community, along with the data that we've been able to look at, I think, we all just felt a need to come around the table and to start developing solutions.
The joint effort is called Caring for Kids. 4 working groups were created: student voice, parent engagement, systems and policy, and community learning and professional development. The Wisconsin Institute for Public Policy and Service has been coordinating the effort.
these kind of what we call wicked problems, these complex problems that have multiple causes, multiple solutions, a lot of different viewpoints, and really a need for many different stakeholders to come together.
Executive Director Eric Giordano says there's no blueprint to solving this.
If we had that, then I think our country wouldn't be in the mental health crisis that we're in. So a lot of what we have to do is bring smart people together and people who care and really talk through what are our shared values, what are our shared interests, and what do we think we can actually accomplish that has some kind of impact and that's feasible.
The hope?
No matter where a child or who a child reaches out to, they have the resources to help support that student or know where to go to get the support the student or anybody in our community needs.
This is just the beginning of our special series supporting students. Tune in each Thursday this Mental Health Awareness Month as we hear from different perspectives on the issues. Often when there are issues impacting children, we don't hear from them. It's the adults making the decisions on their behalf. On this Children's Mental Health Day, 7 Investigates' Emily Davies shares the stories of students raising their voices to bring change.
I've seen lots of kids with low self-esteem and low courage.
I've struggled with anxiety and some depression, mostly through the pandemic.
In my freshman year, really bad. I was having panic attacks once a week.
They're all looking down at the floors, not looking at people, not communicating.
I stared at the ground 24/7. Everybody hated me for it. They were like, bro, just look up. And I was like, I can't.
People joke about mental health all the time.
Joking about depression or suicidal ideology.
It's something you can always hear around you, just walking through the halls even.
It's not beneficial for people to make offhand jokes about this because deep down there is some truth to it.
It's just really hard to see.
I wish adults would be more recognizing of how deeply the pandemic affected my generation.
8th grade and freshman year, that's kind of the transition period, from middle school to high school, and that's kind of take away from us.
The transition from, the seclusion of online school to, oh, we're just gonna drop you in the ocean of what's the West.
It felt surreal, it didn't feel normal.
Coming into high school, I wanted to do I want to do all of the honors programs, honors bio, honors English. But then the pandemic happened and it kind of messed with my mental health.
You could tell everyone was nervous and everyone had anxiety and their own mental health issues that they had developed over the years.
You're just shut from all of your friends, you're quarantined, you can't go outside, you're just kind of in this mopey area.
I kind of enjoyed the secluded learning. I liked being by myself, but I think with some of the events that happened in 2020 and just kind of realizing, oh, this is how the world is working right now and I may not like everything that's going on, that kind of contributed to me thinking, maybe I should focus more on my mental health.
There are external pressures as well, such as family, some people have jobs, clubs, sports.
We're just expected to handle it all and not think twice about it. You can fall behind on checking up on yourself and you might not even realize it, and now you're in this deep hole that you don't know how to get out of.
I lost 2 friends last year. It was difficult. It was a very hard thing to express and to deal with.
I just think it's very important that it's recognized that people still can struggle even though things are seemingly normal.
Suicide is the second leading cause of death for teens and young adults. After the break, why kids are refusing to stand by without a say.
Students from around north central Wisconsin have told us through the Youth Risk Behavior Survey that when they have a problem, they typically go to their friends first, which is why clubs like Raise Your Voice have been so crucial to not only give them the language and tools to be able to have those conversations, but then also have the confidence to talk about what they need.
The pandemic was good in a lot of ways because we all had a lived experience that was very similar and it was really tough on everyone. Really, the kids kept saying, we got to start this club up. I'm seeing my friends struggling.
At the heart, Raise Your Voice is a club dedicated to breaking the stigma around mental health.
The culture around Raise Your Voice is super forgiving and very compassionate towards mental health.
Our friend group were all very academically driven, so I think just letting people know that your grades don't define you and your GPA doesn't define you.
There's this big misconception that just because you experience sadness, anger, depression, whatever it is, that you're weak, that you're not strong enough, that you need to put on this face in public, that everything is just sunshine and rainbows, but that's not true.
A lot of students that I'm around really don't know how to deal with mental health issues and don't really know what to do if they're in a situation that, you know, they need support.
Expressing emotions makes us human. That's who we are.
So I'm hoping that Raise Your Voice can, if not provide it, you know, at least show how you can get to a safe situation.
It's a place for education and improvement and how to help other people and be a support for other people.
We have the bandana project. You see a bunch of green bandanas around the school, so you know who to talk to if you're not in the club, if you're struggling.
We've presented on signs of suicide. We've talked about self-love.
Kids have been trained talking to other kids about mental health, and I think it's really important.
I know as a teenager that we're less likely to listen to like a teacher who wants to talk to us about these things, but if a peer comes to me and shares this information with me, I'm going to be like more open to listen.
It's so heavy. It's a heavy topic, and I think that as well as it should be heavy, it should also be something that is normal and it can be talked about.
I just hope that we can end the stigma against mental health.
Mental health is normal.
One day when I am 30 years old and walking down the street and talking to my friends, I won't have to think about the stigma anymore because it won't be there.
In this week's installment of our special series supporting students, we hear from the schools and after-school programs about what they're seeing as well as how they're trying to support students.
We'd provide a suicide screener for our 6th grade and up. We're now starting to see that at elementary level.
District-wide, we're definitely seeing us struggle with how to handle emotions.
Feeling less and less comfortable around their peers.
We're seeing huge increases of truancy at all levels and trying to re-engage kids and families back into school.
A huge thing is our vaping concerns and substance abuse. Almost every single day we're dealing with some sort of that one way or the other.
We just implemented the vape detectors in our secondary buildings.
I'm stressed out. My anxiety is through the roof and it just helps me calm down.
The binge drinking has increased.
General disrespect. They're just not engaging and they're either leaving or, you know, being disrespectful to the point where they might have to leave the classroom.
Behavior is language. We know that with our students. We don't always know what their behavior is telling us, and that's something that we have to try to find out.
Each student's situation is unique to them, but there are common patterns they are seeing when they're finding out the why of their behaviors.
It's a lot of internalized trauma maybe that's happened in the past and stress that they have, dealing with relationship issues, trying to navigate their gender identity, their sexuality.
This yelling or becoming aggressive, that's how they've survived the trauma that they have been going through in their life.
I've heard about students who've been sexually harassed. I've heard about students who are couch surfing. I've been hearing about students who have parents with substance abuse issues, students who have parents who are either deceased or in jail or prison or something. And you hear this and you see the student and you see how that's affecting those students emotionally.
When you have a pile in front of you, you don't know where to start.
Being completely overwhelmed and not knowing what to do next and feeling like there isn't a next. So they turn to look at suicide or they turn to having thoughts of suicide that I don't know a way out. And so I see that as my only way out.
Schools have gotten creative to do what they can to address all of those inside and outside factors, creating barriers to students' learning, including root causes of mental struggles. Now that you have a window into those challenges, we'll share how they're supporting students and where schools need help.
Kids in Wisconsin are not making and keeping friends as well as kids in other states.
Social connectedness is the Wisconsin Office of Children's Mental Health's top priority when it comes to addressing the youth mental health crisis. With this generation of young people being raised with the internet and screens designed to capture attention, research shows it's impacting how kids take in information and develop relationships.
I went to our middle school band concert and they were talking about the Ukraine incident, what this piece would remind them of. And I was like, I would have never thought of like global affairs in middle school.
The National Institutes of Health found pre-pandemic, 8 to 12-year-olds spent about 5 hours a day looking at a screen, while teens spent up to 9 hours a day. During the height of COVID, the average increased to nearly 8 hours of screen time for 12 and 13-year-olds, and that's not including schoolwork. And the CDC reports 78% of teens don't get enough sleep.
It's a time, early adolescence where kids are developing their identity, their sense of self, and
The skewed and often distorted environment of social media often does a disservice to many of those children.
Murthy has noted, unlike when he was a child, if he wanted to take a break from negative information, he just turned off the TV. Kids today don't have that option, especially when learning and social connections are often online. If kids are up in the middle of the night with their phone, they may be looking for help. The crisis text line found most kids that reach out for help did so between midnight and 6 a.m.
Social media is definitely not very healthy, but it was our last resort, I guess. Like, we didn't have anywhere to go at school because it wasn't an option.
But now we're seeing the ramifications. Kids' inability to communicate face-to-face, being able to solve problems.
The suicide rate in Wisconsin is higher than the national average. We looked at all that and we said, okay, what's the one thing that makes a difference for all of these problems? And we decided it was social connectedness of youth.
7 Investigates' Emily Davies shares advice from experts about how you can connect with your kids.
All people need connection, to feel they're safe being themselves even when they're not at their best. This is especially true for kids whose brains are still developing and who are learning skills to cope and adapt with the challenges life presents them.
When I was really young, I've had some very traumatic impacts in my life, and I didn't really have the best parent supports to help guide me through those things.
Hardworking, Midwestern strong, type of family. So we didn't really have the time to express, what we truly thought. We just kind of like keep moving forward, I guess that kind of impacted me negatively because I didn't really know how to express my problems with myself.
Merrill High School counselor Allie Libby says if you don't know how to start, ask them questions about themselves while in the car.
You don't have to be looking at each other, but talking to them and trying to engage them. Ask them about, what interests they have of just building that relationship.
Noticing and asking questions about them can make them feel seen.
Hey, I noticed that you haven't been hanging out with your friend as much anymore, and you've been up in your room and not coming down for dinner anymore. Is there something going on? Is there something that you want to talk about? And not in like is there something going around? Is there something you want, just like an open way.
So our enzymes are going to
DC Everest Senior High Science teacher Tony DeGrand has become a safe place for many of his students. He noticed his students were not engaged, so he asked, truly wanting to know how they were doing.
I have letters from them essentially saying, DeGrand, you have no idea what a difference that made.
When kids answer your questions, they'll be noticing whether you're actively listening to what they have to say and are willing to take the time to understand them, rather than just trying to tell them what to do.
Well, this is what I did, and this is how you should handle it, and trying not to do that, but just really sitting and listening and validating how they feel, and then asking, how can I best support you?
Listening to hundreds of students, she says the world they're experiencing today is vastly different than the one even people a few years older experience. Instead saying,
thank you so much for telling me about this. I really appreciate you coming to me. Do you want me to be here for you and try to solve this problem, or do you just want me to listen?
They may not know what they want. In that case, thank them and offer the opportunity to help them figure it out or talk again.
We don't always have to have an answer for something, but our kids want to be listened to and valued and understood that they're going through hard times.
And I just reaffirm to them that I'm happy that you're here, and I'm sorry that you're going through this, but I'm happy that you feel comfortable telling me.
Research continues to show it can be even tougher for rural districts.
7 Investigates' Emily Davies spent time in the Anago School District. She shares what they're doing to help students and where they need help.
Do you need a writing utensil? There's writing utensils on my desk.
All schools work to provide students academic and life skills.
Determine if both biological parents have the gene prediction.
So regardless of what they're born into, they have a chance in the world inside and beyond the school doors.
It's about how do we layer multiple systems of support together.
Heidi Siebert is the Director of Pupil Services and Special Education with the Anago School District. She says they face a lot of challenges, like that Langley County has the 3rd highest number of kids per capita entering the juvenile justice system behind Racine and Milwaukee.
You'd think, what, Anago, Langley County, but we have needs that are not always acknowledged by the greater community, that we have people that might be struggling more.
Anago serves nearly all of the students in Langley County. Overall, 65% of Anago students qualify for free and reduced lunch. At the elementary level, Siebert says it's 4 out of every 5 kids. And without proper supports, poverty is a risk factor that can lead to kids having poor mental health. But that doesn't mean they can't have high expectations for those students.
What do we do for all students to help all of them reach their goals, but just knowing that we have some barriers that we need to make sure are not barriers for kids. We have to take those barriers down.
Removing barriers takes more resources, which often costs extra money. Siebert says districts like Anago don't have the same level of taxes, state and federal aid, or general funding for students compared to districts with less poverty. Grants are also competitive and temporary.
We just need more help.
Nationally, nearly all school districts don't meet the recommended number of mental health positions per student. That goes for Anago too. Siebert says they've focused on training for all staff and school supports, like the school resource officer.
She's really good at mental health stuff.
The mentality that we have had here in Anago is nobody's coming to rescue us. So what do we do with what we have in the best way possible?
Social worker is one of those positions where the school district is short. As of 2 years ago, they didn't have one. Now Amanda Moore covers the caseload that national best practices recommend 8 social workers to cover.
We also don't have that treatment level, so right now we're reacting instead of being able to get ahead of it.
She tries to get them connected to therapy if needed, but the wait times can be 6 months long. Providers can be 100 miles away. Reliable internet for telehealth providers may not be available at home, or the provider is not covered by their insurance. It's why the district used temporary pandemic funding to create a mental health navigator position and brought outside therapists into schools.
Over the last 5 years, we went from having these services maybe 1 time, 2 times a week for just our high school to we have access to a therapist every day, and we actually have elementary students also being able to be referred for those services.
Therapists rely on the student's insurance, not the district paying for sessions. However, getting those services in schools is what research has found breaks down not only the physical barriers, but social barriers too.
They're not missing as much school. They're, doing their session and going right back to class. Parents aren't having to take off of work.
That continues for students after school with even fewer barriers.
We do have a mental health coordinator here at the Boys and Girls Club who sees our members for free and provides one-on-one counseling for them.
You cannot separate the social emotional from the academic. Kids are whole. We have to treat them as whole children.
Medicine is ever evolving. In today's world, mental health is being viewed and treated differently than in the past.
The American Academy of Pediatrics says it's at a crisis level for our children, meaning more people who are not mental health specialists are having to get involved.
Primary doctor is a starting point for many families.
And a lot of times families will say, oh, my kid's teachers thought we should come in and see you.
He's spending more time treating patients for things like anxiety and depression than ever before. Wait lists for a child to see a psychiatrist can be as long as 6 months to a year. So Dr. Chan says he's often responsible for diagnosing mental illnesses, linking families and kids with resources, and in some cases, getting kids started on medication.
It's definitely become a bigger part of my practice than I would have expected.
They're trying to integrate that learning and awareness throughout the system, especially after the federal government and accreditation organizations recently began requiring hospitals to screen patients for behavioral health conditions and suicide risks.
Not all of our providers are really looking at that. They're treating the patient, and it's not that they don't care about all of the things, but they might not be aware of how to ask those questions or how to identify signs.
Research looking at people who died by suicide showed that nearly a third had seen a healthcare provider the week before. More than half had a visit within the month, with people averaging nearly 17 appointments during the year.
Governor Tony Evers declared 2023 as the year of mental health, calling it a crisis. He laid out roughly $500 million in mental health budget priorities, many focused on supporting kids. After the legislature approved its version of the budget, 7 Investigates' Emily Davies explains what's passing and where local and state mental health advocates say there's room to act.
Schools are natural hubs to get resources to kids. It's partly why districts try so hard to address so many needs that go beyond the academic.
We're just spinning our wheels.
Like Antigo, districts have used grants and pandemic funding to try to support students' mental health.
So we've used those funds to try to build our systems and our capacity of our staff so that once the funds are gone, we can at least have something still in place, because we never are guaranteed funds.
So what we really need for kids is stable funding for school mental health.
Linda Hall, the director of the Office of Children's Mental Health, says when it comes to the budget and policy changes, school-based mental health initiatives are the office's #1 priority.
While less than half of kids who are diagnosed get mental health treatment, of those who do get diagnosed, 75% of them get treatment at school.
Schools have had difficulties hiring and retaining mental health staff because candidates don't know if they'll still have a job in a few years when the money runs out.
There are a lot of school districts, especially in rural areas, who don't have the staff that can invest time in, continually applying for grants. And then with grant money, you can't always do some of the things you want to do in an ongoing kind of way.
The governor's budget recommendations added about $270 million of ongoing funding to school-based mental health supports, like hiring mental health professionals and providing training for staff like teachers. The legislature so far has approved only about $30 million for that purpose, much of that still in grant form.
We always would like to see a little bit more, but I think it's, for mental health, I think it's a good start.
Representative Pat Snyder says he believes in sustained funding for school-based mental health services. But as he told us in April,
I've been preached to that, okay, we can't grow government and we can't spend a lot of money. So I try to look at ways of legislation that will help them achieve the goals they want to achieve.
He was happy to see other things go through that advocates have recommended, like increasing the number of psychiatry residents at the Medical College of Wisconsin, and an expansion to a program that helps people waiting to see a psychiatrist get help through their primary care provider more immediately.
It not only teaches physicians, kind of gives them like triage education. They will be able to maybe see them and be able to help treat them to get them through until that time. And also to have resources for parents, be able to help their daughter or son get through this until they can see a professional.
Being able to pay for those services is another barrier. Some providers are not in network for families, whether they're on private or Medicaid insurance. And some providers don't take Medicaid because of the low reimbursement rate.
A third of all kids in Wisconsin are on Medicaid, so this is huge.
The legislature did not approve a full Medicaid expansion, but did provide some increases for Medicaid reimbursement, just not in all services. The legislature also did not include the governor's request to require all insurance to cover services provided by a therapist in training. It's something advocates say could alleviate the cost and shortage of mental health professionals.
Of major depression.
These are people who have completed their master's degrees. They have experience already. They just are not yet licensed. They need a little more practice. And they are completely supervised when they go to schools.
I kind of just say that if we don't have healthy kids, then what's the state going to look like down the road?
Things can change as the budget process continues. The Office of Children's Mental Health has a massive list of gaps that can be filled, places where we can do better as a state. You can find all of that right now at WSAW.com.
Sun Investigates has been churning out stories about children's mental health crisis for the past 2 months. You can find all of our past coverage under the Youth Mental Health tab at the top of our page.